One other reason to celebrate the year anniversary and the enactment of this legislation. Let me just give you one more example, Madam President. A couple weeks ago, I was at the Greater Baden Health Center, located about 7 or 8 miles from where we are today. They're doing something about the infant mortality rate in our community. We have too high of an infant mortality rate because of low birth weight babies. Some don't survive and become part of our infant mortality numbers in America, where we are much higher than we should be. Others survive and have complications that need to be addressed by our healthcare system, making it challenging for the infant and expensive for our society. Well, at the Greater Baden Health Center, they're doing something about that. They're expanding their qualified health center to include prenatal care, so pregnant women can get the type of attention they need to have healthy babies. That money comes from the Affordable Care Act because of the expansion of our qualified health centers. We all celebrate what we're able to accomplish. It will keep our children healthier and save us money and have less use of the emergency rooms by expanding care at our qualified centers. And Madam President, if you're concerned about health disparities in America, and you have reason to be, minorities are 2 times more likely to suffer from diabetes, 33% more likely to die from heart disease. In the African American community, the infant mortality rate is 2.3 times higher than the white community. When we look at the number of people that have access to health care and health insurance, minority population represents 1/3, yet they are 1/2 of the people that don't have health insurance. I think we all agree that we need to do something about that. That's just not right in our sense of fairness. But let me just give you one more reason. It will save us money. A study done at Johns Hopkins University and the University of Maryland point out that we can save $260 billion in excess direct medical care costs if we can deal with the minority health disparities. Now, we have done something about that in the Affordable Care Act. An amendment that I was proud to introduce established the Institute for Minority Health and Health Disparities within the National Institute of Health. And we have developed minority health and disparity offices in each of our agencies that deal with health care to do something about health disparities in America. We can all celebrate that we're able to move that forward in the Affordable Care Act. Madam President, we should all take pride that America, at long last, after decades of unsuccessful attempts, has acted. And health care today health care is a right, not a privilege. No longer, as our dear friend, the late Senator Kennedy said, we no longer have a sick care system. We have taken action to include all under health care in America. Now, I understand that the Republicans in the House want to repeal each and every one of these improvements and accomplishments. And they offer no hope of taking these issues up in a serious manner during this Congress. Speaking on behalf of our seniors, speaking on behalf of our small business owners, speaking on behalf of the consumers of health insurance in America, speaking on behalf of what is right as far as covering and making sure everyone has access to affordable care, we don't want to see that happen. We don't want to move backwards. We have reason to celebrate the accomplishments of moving forward with health care. We want to move forward, not back, and continue to build upon an American health care system that provides affordable, quality care to all Americans.